Happy Sunday, folks. A great Sunday to each and every one of you. We trust that you folks are well today. Let us know if you're hearing us loud and clear. Welcome to our international podcast, Below the Belt. We trust that you guys are great. We trust that you guys are fantastic. You're fired up on this Sunday, guys. You're ready to go. Good to see Joan Chase, and I see also Vanessa De Silva. Maureen Williams is here. Andrew Cuthbert, Sandra Ford. Guys, it's been good burn. I see Sandra. Yeah, Sandra Ford again. Sandra Ford says up. Vanessa De Silva says loud and clear. Technician picking up on the Facebook. And Vanessa, so we promoted you one time. Technician. Good to have you. Beryl Crawford. Vanessa again. Vanessa De Silva. Good to have you. Is it George Hector? Good to have you, George. Paul DeAngelo. Maureen Williams is joining us too on YouTube or Tubers. Maureen says she's still in her bed. Folks, when I grew up, I want to be like Maureen. I want to be like Maureen. It's 12, you're still in bed, you're taking it easy on a Sunday. Good to have each and every one of you folks. I see Gloria Van Kooten. Felix has joined us. Good day, Gloria. Good afternoon, Gloria. I see Rihanna Mingo. Gloria Gordon is here as well. I see Diane Mitchell. All the Dianes come out. Selena Fraser. Selena, how you doing? So great to see you, Selena. So great to see you. We hope that you are well. You have full of life, Selena, and strength. And we pray God's guidance upon your life. Good to have you, Clifton Stewart, and all the other guys joining us. Joyanne, Bailey, Morgan. One person, four names. Joyanne, Bailey, Morgan. Good to have you, Joyanne and St. Romain Adams. Andrew Cuthbert, good to have you. I see it's Ro Andre Wilshire. Good to have you, Ro. I see Grices is here. I see Siobhan McDonald. Good morning to each and every one of you. It's a fantastic Sunday where we are quite sunny outside. But we've been having a quite a spell of rain over the last few days, haven't we? Quite a spell of rain. But we trust that you guys are great, that Sunday has greeted you well, and you're taking in some time for family, you're taking in some time for yourself. Me time, you time. Yep. We hope that you guys are doing that. Some time for yourself, some time for family. And as Maureen is doing it easy on a Sunday morning. It's 29 degrees where we are in the national capital city of Georgetown. But the guys are telling us it feels like 36. 29 degrees. It's a bit hot, folks. It's a bit hot. I can't lie. It's a bit hot. We got a couple things we want to share with you. We're going to be talking health with Dr. Cummings, Karen Cummings, and just a little bit. We've been talking about this maternity, the maternity deaths, the mortality rate. And we sat down with Dr. Cummings recently and talked with her about that. And we want to share that with you. But just in a little bit, we got some things we think we ought to talk to you about before we get into that discussion with Dr. Karen Cummings. Folks, your health is so important. Your health and wellness is so important. It's so important, folks. Your health. Rihanna Mingo it says it's nice and cool in Toronto. We're so happy for you, Rihanna. We're so happy for you. We hope that you, Rihanna, and all the other folks who are listening to us, you're taking your health into consideration, and it's a paramount importance. Lots of time we take our health for granted until it's too late. Until it's too late, we take our health for granted. Our health and wellness is when your toes start paining you. Then you realize, you know what? I don't take enough time to say thank you, Father, when I have good health. But you let a little pain bite your stomach. Oh, God. That's the first thing you're going to bawl out. Oh, God. But be thankful when you have good health as well. Call on God even when you have good health. Oh, God. Thank you for good health. Just a bit of advice as we're going to get into that a little later on. But first, folks, we're following this accident over the weekend. Just yesterday, they're telling us you had an accident involving a man on the East Coast, all the way up at Enmore. all the way up at Enmore. This accident happened. They're telling us about 4:30 yesterday afternoon. We're picking up some of this reporting out of our affiliate website, Credible Sources, and then Turner relying on two sources for their report. And we're being made to understand that this cyclist, now deceased, was only identified as Raj, has been only identified as Anil rather, also known as Cake Man. And Anil's wife said he had just left home. He had just left home when she got a call that changed her entire life. Anil was hit down on the Enmore Public Road. And according to the reports we have been following, died almost immediately. Died on the spot there where he was knocked down on Enmore Public Road. And they're telling us that he sustained severe head injuries. I think iNews is reporting that Anil sustained severe head injuries. Folks, we say it all the time here. This right here, this is the other epidemic. I think it's only COVID and monkeypox we got to deal with. COVID and all its variations. I was reading some piece of literature over the weekend here and read that the COVID-19 variant, I think it's the Delta variant, has about 300 strains. Oh, it's dead, we dead now. It's dead, we get dead now. This is the other epidemic, folks. The carnage on our roads and our waterways. And then we talk often about violence against women and girls. There's that other epidemic. But we're going to be detained by this one here today, the carnage happening on our road, the loss of Anil, so senselessly. And they're telling us, we're picking up from Uncut News, Guyana Uncut News, that the motor vehicle is alleged to have belonged to that which transports Minister of Public Works, Wanajil. And we remain unsure this time whether Ajay was in that vehicle. At the time of the accident, you know, these guys fashion themselves to be prophets and all that. They see the coming. We need to understand that the vehicle, again, which allegedly transports Ajay, was en route to Bobis. And it's coming down back. They're telling us. It's coming down from Mahika Bobis. It's returning from the ancient county that this accident took place. What is very, very telling, it is being reported that police came on the scene. It's being reported that police came on the scene and immediately removed the license plate from that vehicle. That's what we're being made to understand. The police came on the scene, Karen Thomas and Linda Thomas, Isabella Butters, Ingrid King, Terry Ann Grenville. Police arrived and removed the number plate from the vehicle. You see? Apparently, last month wasn't the PP month, and this month is not their month neither. They can be hastening to get out of this year altogether and hope that 2023 bears better fortunes for them. But it's not their month. Last month wasn't their month neither. Probably the year don't belong to them. It's one scandal and one purgatory to the next. Confusion powder raining down. And that's part of what we're hearing here. that when the EMT came, the emergency medical technicians, when they came and they did what they had to do, Arnold was pronounced dead. And this vehicle that they tell us, which ferries the Minister of Transport, Minister of Works, was to be blamed. The vehicle which allegedly transports the minister, according to reports, was involved in this accident. And that's what we're hearing at our end. And folks, as we go about, we got to be so careful out there. We got to be so careful on the roadways. You know, when I hear the guys in the back of me blowing, I pull in the corner. I give them the way. Those that have a need for speed, I put in the corner, guys, and we give them the way. Dan Walters, Yolanda Thomas, Ingrid King, Andrew Cuthbert, pull in the corner. We give way to them. We give way to them, boys. Well, we caught up with one young lady who took to social media. She's so fed up. Every car got sirens and this and blinking lights and coming through. And when you see them boys coming in, they start thinking, you gotta pull in the corner, you know. You gotta brace it over. When you see them boys coming through, because they move you out the way, you know. If you don't move out the way, they move you out the way. And you know, thoughts and prayers go out to this family. Our thoughts and prayers go to Arnold's family. Certainly cannot be an easy time for them. Pray. Yep. Can be an easy time for them at all, folks. Pray for them. Pray for that family. So we caught up with this young lady who shared some thoughts on social media, but what she saw, she's so angry by another senseless death on the road, as all of us should be. As all of us should be. She's angry by it. Totally angry by it. Let's take a listen to what she said, folks. Concerned citizen.
I need all my Guyanese people on board. I'm not gonna sit down and keep my mouth shut. I just passed a DEF driver hit down a man at Enmore there. I hope something come out of the story. It's ridiculous that every single time a government official has to go somewhere or a DEF driver is passing, they are going at a rate of 120, 160, pushing people off of this road. That is not the way it's supposed to be. Guyana don't have roads enough to keep pushing people off of the road, coming out of the blue, hitting people down. Now somebody's dead. Why are you guys in a rush every single time? Why can't you leave early if you need to go somewhere? Leave like regular people on the road. Somebody is dead right now as we speak. I just passed it 15 minutes ago at Enmore. A young man is dead on the road like a dog. I want to see what will come out of the story. It's Guyana as usual. Nothing probably will come out of the story. But I want this to reach the government people and all the government officials and the DEF people. The people of Guyana are dying while you guys are racing to go to wherever y'all gotta go to. So think again.
Yep. You heard that, folks? You heard that. She's angry. She passed. She saw what transpired there. Dead body on the road. Senseless death. If we only slow down, we could arrive alive. Folks, we can share the live this morning or with Lyman. We can share. I gotta circle back to what she said. We're gonna share the live today or with Lyman, we spectating. We come out to spectate or we can do some work today. We can be a little more interactive. What do you think about that, Andrew Griffith, Mavis Davis-Well, Yolanda Thomas, Ingrid King, Rihanna Mingo? What do you think about that? That's the other pandemic we face, that sheer carnage on the road. Smash that emoji button for us, folks. And share the live. We want other folks to get valid credible information. When you're joining us on Twitter, you're joining us on YouTube, Respect and Manners, you're joining us on Facebook, you're picking us up from LinkedIn, Respect and Manners, folks. I wish we had some uplifting news to tell you guys. But through it all, you got to be motivated, you know. You're not going to get too much external things in this country to motivate you for. You got to call on your stores on the inside. You got to call on some strength, summon some strength from deep within as we move forward into this new week. That's what she said. She's so angry. And I can understand why. You get fed up over time, you know. You just want to pack your bags and go. You get fed up with this nonsense. If that went by a little too fast for you, here is that young lady again, a concerned citizen, sharing her thoughts, what transpired just yesterday afternoon, and then more public road. Take a lot of listen, folks.
I need all my Guyanese people on board. I'm not gonna sit down and keep my mouth shut. I just passed a DEF driver hit down a man at Enmore there. I hope something come out of the story. It's ridiculous that every single time a government official has to go somewhere or a DEF driver is passing, they are going at a rate of 120, 160, pushing people off of this road. That is not the way it's supposed to be. Guyana don't have roads enough to keep pushing people off of the road, coming out of the blue, hitting people down. Now somebody's dead. Why are you guys in a rush every single time? Why can't you leave early if you need to go somewhere? Leave like regular people on the road. Somebody is dead right now as we speak. I just passed it 15 minutes ago at Enmore. A young man is dead on the road like a dog. I want to see what will come out of the story. It's Guyana as usual. Nothing probably will come out of the story. But I want this to reach the government people and all the government officials and the DEF people. The people of Guyana are dying while you guys are racing to go to wherever y'all gotta go to. So think again.
Such a shame, folks. Such a shame. Such a shame. Just a senseless loss of life. What else can you say? Such a senseless loss of life. And he just left his house, going kitty cat on his cycle. And then this van comes and, as the folks said, pushing through the late. They got to hustle and go. They come through, you got to pull in a corner. That's living and dying in Guyana cheap. Saw some comments on TikTok where we posted that video on our TikTok channel, and the folks are equally upset. You know, they're going to pay for the family funeral and give a little 5 cents, and a little life gone down the drain. Life gone down the drain, and nobody's going to be held accountable. You heard her say, this is Guyana. This is Guyana. Could be any one of us, and that would be the modus operandi. Andrew Griffith says Guyana falling apart daily. That would be the modus operandi. Leroy Gavaya, Chandel Moses. That would be the modus operandi, Onessa Ward Dean. God forbid. The soil in this country crying out for justice. For all of those who have passed on in this manner, and justice remains elusive. I don't know, like it's not them boys here, it's one nonsense to the next, one foolishness. And the things that should consume them on a daily basis, they're distracted, focusing on all manner of nonsense. And this is your other pandemic. Sheer carnage on our roads and our waterways. Sheer carnage among our women and girls. Domestic violence, interspousal violence is tragedy on every front. The economy failing us, high cost of living. The health sector, which we're going to be talking about in just a little bit, leaves much to be desired. Health and safety, public safety, international relations, you name it. That's why I said, when my storage is empty, you got to call and fall upstairs. Because you ain't got too much externally going to motivate you in this country. You know, like Maureen, you might want to get out of bed. Maureen is just getting some R&R, much needed. and required, but you might want to get out of bed many days because of the sheer weight of disappointments that is becoming this country. The sheer weight of it. Folks, wherever you're joining us from, smash that emoji button for us. Share the live. We want others to get valid and credible information as well. And partner with us, guys. You know, this is our anniversary month. And we cannot do these programs without you folks. Credible, valid information. We understand how much you require it as part of your daily routine. To know what's happening back home, to know what's happening in the country. And we're doing our bit in our own little way to bring you valid, credible information. And this is our anniversary month. We are 2 years old this month. We've been out here, believe it or not, for 24 months, program after program. Much of it comes out of the pocket. And if you're in a position to help, if you're in a position to partner with us on a monthly basis, or even on a one-off basis, we welcome your contribution. We welcome your generosity, folks. And as it says here, we're available via Cash App and Zelle and PayPal. We are available via MMG and MoneyGram, Western Union. One number we do all this via is 627-6963. 627-6963. That's the only number we do business on, like this. And we want to let you know that each contribution goes towards building out these programs, improving them, and bringing you quality, credible, valid information. That's what we have a passion for doing, representing the people of this country, lobbying, challenging the current regime to do better. That's our passion, and that's our hope. Michaela Andrews quotes. Those of you who are joining us via YouTube, right from that YouTube chat, you can partner with us. There's a dollar sign at the bottom of the chat. You'll see the dollar sign there. And if you click on that, it'll tell you how you can contribute in real time to our program, right from that YouTube app. And guys, if you see one or two ads when you're watching back the programs later on, we beg your indulgence. We beg your indulgence. If you see one or two ads, if you come back and you look at the program, we beg your indulgence. We really want to build this program even bigger than it is, even more professional than we try to do it. And your love, support, and generosity means the world to us. It's fuel to keep us going. Thank you guys so much. We sat down recently and we talked with Dr. Karen Cummings because we were concerned about the maternal deaths we're seeing in this country. They seem to be going up after we've been coming out of a period of trauma in the healthcare system from the last dispensation and iteration of the People's Progressive Party civic government. And having spent 5 years doing the hard work of modernizing healthcare, bringing down maternal deaths and bringing back respectability to the Georgetown Public Hospital Corporation, folks, we're faced with it once more. And if you've been paying keen interest to what's happening, you've been seeing cases after cases, almost a spike of maternal deaths at the Georgetown Public Hospital Corporation. You check in, you admitted to give birth, and something along the way goes wrong, and we've been losing quite a few women like this in the last few days, in the last few weeks. We sat down with Dr. Cummings quite recently to talk about that. We want to share that discussion with you. I'm certain it's going to be beneficial information to you. Continue to share the live, folks. Smash that emoji button and partner with us as we talk with Dr. Cummings as part of the work we do for our affiliate Credible Sources. Here's Dr. Cummings and I sitting down quite recently and talking about what's happening in healthcare, especially as it relates to maternal health, maternal deaths in this country. Them boys ain't know what they're doing, you know. Frank gone AWOL, absent without leave. And there's a free fall the healthcare system like much else in this country. It's a free for all. And our folks, our citizens are at the mercy, life and death, every day. And some don't make it out alive. Here's Dr. Cummings and I talking recently on the SU. We're privileged to be talking with Dr. Karen Cummings today. Folks are very familiar with Dr. Cummings, who was our former Minister of Foreign Affairs. She also served as Minister within the Ministry of Health, and that is her training and the background. She is a public health expert, a doctor by profession and practice. And Dr. Cummings recently put out a very, very strong statement on maternal deaths. And that is where we want to pick up our conversations today on the spate of maternal deaths we've had coming out from the Georgetown Public Hospital Corporation in particular, but even from some outlying areas. We've been hearing of cases of where young mothers have gone in to deliver, whether it's Region 7, Bartik in particular, Region 9, and some of the other outlying areas, and they haven't fared well at all. Dr. Cummings, what is happening in healthcare from that perspective? Talk to us about that.
Good day, Sherrod, and thank you for having me on your program. It's a pleasure. I must let you know up front that since in the 20th century, to be exact, I think 1987, we have been promoting the concept of safe motherhood. And so in 1987, we more or less signed on and acceded to the Universal Declaration on Human Rights. And by so doing, the then administration committed to, among other things, to strive towards the elimination of all preventable maternal deaths. Concurrent with that, commitment was made for the formulation of requisite policies and programs, and so we managed to get some additional resources became available to the Ministry of Health to ensure the desired results and, shall we say, health outcomes. The Family Health, and more specifically the Maternal and Child Health Department, embraced the concept of Safe Motherhood initiative. And so we talk about 5 pillars. You have the preconception care, whereby if you're contemplating pregnancy, you're in the reproductive age between 15 to 49, you can always come into the clinic and discuss it. You know, people see the clinic as only when you're sick you go into the clinic, but it's preventative and primary health care, and so that's the first stop in terms of community health. And so we want patients and persons, clients, to come in and just have a word with the physician. We want to improve that doctor-physician relationship, and even nurses as well, with nurses. And so, as I said before, we had this concept of preconception care. So long before you plan on having this baby and this child, you come in and talk to us, and we walk you through the menstrual cycle and so forth. And then we talk about antenatal care, when now you've recognized, okay, I'm HCG positive, I'm having all the signs, the presumptive signs, the probable signs, the positive signs of pregnancy. So I said, okay, you come until you've joined the clinic. And we try to encourage our mothers to join the clinic in the first trimester, early, like 12 weeks of pregnancy or before, Since you know you're pregnant, just come and join the clinic. And so we can walk you through the tests you need to be done, because there may be hereditary tendencies. You may have, some of these diseases that early detection can save your life and your baby. Because the main thing of safe motherhood is to have healthy mother and a healthy child, baby, infant. And so we talk about, as I said before, preconception care, we talk about antenatal care. Then we talk about trying to avoid the high-risk pregnancies, because mothers, like everything else, they will have hypertension during pregnancy. It's something new, you get scared, and so your pressure keeps rising. Sometimes you have a family history of diabetes, and so we call it gestational diabetes too as well. It shows up during pregnancy and so forth. So we want to ensure that you come and we talk to you about these high-risk pregnancies, and you may need to move from our clinic and be transferred to the Georgetown, our level 5 clinic. Then we talk also about the fourth pillar. I think it's clean delivery and safe delivery, because you would recall that our health is decentralized, but apart from that, we have our not only coastal areas but hinterland areas, and so cultural practices. The nanny delivering you and doing their own thing. So we try to persons from going to the nannies, and so we have trained them. But let's try to have our deliveries at a not even a health center, at a district hospital or the regional hospital or the level 5 hospital. And so we talk about clean and safe delivery. And the last pillar of the five is the postnatal care, postpartum. You've already delivered your baby. Now, we walk you through it during pregnancy, and now we want to make sure that now you've finished, we still want to make sure the next 42 days that you're okay. So that has been our concept all the time, and we've been talking about that safe delivery. So
And getting the results too.
and getting the results.
Because Georgetown Public Hospital Corporation, for one, had a lot of maternal deaths in the past.
In the past.
In the past, pre-2015.
Yes.
And I think in the 5 years we've had the APNU AFC-led government, we were able to bring that down a lot.
Absolutely, absolutely. In fact, when we came in 2015, that was more or less the tail end of, we call it the Millennium Development Goals, especially Goal 4 and 5, where we talk about maternal deaths and infant deaths. And so we didn't do so well. So we came in with knowing that in mind, and so we work assiduously, and now we have the Sustainable Development Goals, SDG 3, and Target 1 talks about, calls for reduction of global maternal mortality ratio, less than 70 per 1,000 live births. And while Target 2 speaks to the preventable net deaths of newborns and children under 5 age by 2030. And so we certainly would want to have the neonatal ratio also being decreased, not just the maternal, but the neonatal ratio. And WHO, and they're talking about 12 per 100,000 live deaths. So considering the commendable impact of previous efforts, as I said before, in healthcare, we are now extremely disappointed in what's happening now. And so we see in the papers captions like maternal death at GPHC being investigated. That's February 27, 2021. New mother deplores conditions at New Amsterdam Hospital, says she contracted infection while giving birth. That's November last year. 24-year-old mom and baby girl die at New Amsterdam Hospital. These are captions we read in the papers. Lodged woman and unborn child died at GPHC October 20, 2022. And then just last week, Navita Maraj and her unborn child died at what's that? So it's really unacceptable. And so I must say that during our a partnership of National Unity Coalition tenure in office, stringent efforts were pursued to ensure greater access to primary health care of the pregnant mothers. Additionally, we did some work, we call it respectful maternity care, because they always this notion, it's alleged, that the nurses don't speak well to patients and the attitude and so we took all of that into consideration, and so we tried to work on efforts to transform attitudes, interpersonal communication and training of values. Those were some of our undertakings. And so the Guyana maternal mortality rate for 2015, when we came in, it was 172 per 100,000. But by the time in 2014, and so by the time we came in 2015, it had dropped. It had dropped about a decline of 0.59%. And then also in 2017, we had a similar drop from 2016 to 2017. And so we were aware of contributing factors, because it's a holistic approach. And so we know poverty plays a part, pregnant mothers living distances like in the hinterlands, lack of information sharing, health literacy. We need to step up, educate our mothers. And of course, there were inadequate services. In some cases, like the hinterland, there weren't any specialists. And when we were there, we ensured that we sent specialists, gynecologists and obstetricians to these areas. And of course, we know there in those areas, especially, there are some cultural practices that need to be changed. And so we were working assiduously in all areas, all fronts, we would say, to improve pregnancy health outcomes. And further to that, we had waiting homes in Maruka, I think along the East Bank, Sand Creek, I think. We also had at Letham Hospital, Upper Takutu, Upper Essequibo region, and in Anai, and in the Barima Waini region. And so to our minds, it was a significant improvement, development, providing the kind of quality care for the antenatal mothers and their newborns. Also, in addition to that, 133 millions were obtained dollars were obtained for the expansion of Georgian hospitals. You would recall people were saying that two on a bed, two persons, mothers
Yeah,
sleeping on a bed.
indeed.
So we decided to do something about that, and so we expanded that. We had some money, as I said, I think it was to the tune of $133 million were donated for the expansion of the GPHC maternity wing, and so extra 50 beds were placed there. In addition to that, we had the Inter-American Development Bank (IDB) loan a sum of 800 million US to assist in this reduction of maternal deaths, perinatal deaths, and neonatal deaths at 140 health
Yeah.
facilities and 88 communities, benefiting at least 140,000 women and 9,000 newborns. And it's supposed to be per year over the 5-year period. And so, additionally to that, of course, training is important. So we work with PAHO, our technical advisors, and so they bought for us, we call them birth stimulators, to assist the healthcare personnel to see when the baby is coming, out of the pelvis opening. And this expanded the teaching and the undertaking of obstetrician nurses and our doctors, the obstetricians, and alerted them as to what kind of maneuver, depending on the baby, the position and the lie of the baby, as it's come down says descent. And so we made every effort to ensure that we have positive health outcomes and ensure that what we do is in acceptable standards worldwide and common practice, that the pregnant woman should not lose more than 150 mils of blood during labor. Of course, there are the 3 stages of labor. When the contraction starts, it comes a little more, and then the baby is expelled, and then the placenta is expelled. So there's a lot of blood loss. If it's a normal vaginal delivery, about 500 cc's, and if it's a cesarean section, it's going to be a little more, maybe 1,000. But you want to minimize the loss of blood. And so we're trying to do these things quick, quick maneuver. We want to get the baby out as fast as possible, but we shouldn't compromise the risk of infection, the risk of injury, and the blood loss, as I alluded to earlier. So from the APNU standpoint and our government in waiting, these recent maternal deaths, we are asking that they be subject to mandatory post-mortem. Let's see what's happening, and proper maternal death review processes. Because we've been having all these deaths, but the last time I read, the minister was saying, Dr. Frank Anthony, it's negligence by negligence by the health personnel. But what's being done? And I mean, how are
Exactly.
it's not just saying something, what's being done about it?
Dr. Cummings, you hear negligence by medical personnel as one reason, but what might you say could be some of the other challenges they're having?
Well,
Frank seems to have his hands full.
of course, I think that the ratio, these are critical care, and I mean, you want healthy babies, life and death situation. We say half inside you have life and half death, and you're being pregnant.
Yeah.
That's the colloquial parlance. But so we must have like one nurse to 2 patients the most, I
Because
think.
clearly, the coalition administration was stemming the tide of maternal deaths based on its program, rigorous programs, implementation policies it had, and so forth.
And having a
But
human resource,
all
because
of
we
that, yeah.
actually shifted nurse from Linden to come as well to boost the amount of the human resource in Georgian Hospital, because we know that at that time, Linden, they were having 0 maternal deaths, and they had overwhelm of nurse midwives and so forth. So we asked them to come, we set up places for them, we built the homes, and we took care of them. And so it was really on the low side, And it's really sad now that, and then there, of course, remuneration. Once we're losing our nurses to the greener pastures, now that we have visa-free and so forth, more nurses will be going. So we have to make the package interesting and attractable so that the nurses can stay. And you love the pride. You know, we have hardworking nurses here and hardworking health staff, but we have to treat them as such. They can't be second-class citizens in their own country. And so we have to spend some time, invest in them, monetary and otherwise, conditions of service, you know. I recall even during COVID, we had to shift nurses from one area because they're short,
Yeah.
you know,
Yeah.
and we're training them out, and we're just training them out for export. So we have to do much about that. And
Doc,
so,
Doc, I hear you on the resources end, and
Yeah.
you know we cannot not talk about the fact that some of the resources are being misused. We saw an ambulance the other day smuggling chicken. I mean, definitely it's not available to patients during that time. How many times per day is the ambulance making that kind of run?
We don't
and
know.
we hear from citizens, you call for the ambulance, and then you hear not available. You might got to call a private ambulance where you got to pay out your pocket. You know,
Absolutely.
so these are the kind of challenges that we're seeing and we're hearing about. Certainly,
right.
this did not obtain under the last administration, the AFC
absolutely,
administration.
absolutely. And the irony of the whole thing that the government is bent now in having a new women's and children hospital, $32 billion in Ogle. So if you can't fix what's already there, I mean, what's the point of getting a new building where these changes haven't been, we haven't put our hands on these changes? How are we going to improve the situation?
Yeah.
You know, I mean, it's
Indeed.
good to have women's and children hospitals. Of course, we are becoming an oil-rich country now. But then there's some basic things that we have to fix right before we can go on to upscale and you know, to scale up.
Yeah.
You know?
And one of the
Yes.
strategies we don't see is when you have these maternal deaths, you don't see the follow-up in terms of the investigation.
That's right.
And as you rightfully said
Yeah.
there, we don't see persons being held accountable. It's one thing to point out the deficiency, but they say, this is how we have fixed
That's
this,
right.
this
That's
problem.
right. That's right. We have not heard of that. Just negligence, and that's it. What are we doing? What are we going to do differently? You know, we need to hear from our minister about that. We have to hold him accountable because the buck stop at him.
Yeah. As you articulated earlier, Doc, here you had a spate of these maternal deaths. What would you say to those families? Clearly, their families hurting by the system that we have now.
Well, it's really sad indeed. If it's a person who, I mean, it can scare the person who wants to get a child now. But I would encourage them to go to the primary health care facility next to them. As I said, it's going to come under the aegis of preconception care. Under the nearest health center there and talk it through. And then we have something called family planning. So we want to ensure that you don't narrow your spacing of children. I think when I was in medical school, 3-9 spacing was it, well, even up to 2 years at least, you know, but 1 year next year, you know, then your uterus, because someone said that the uterus would have been ruptured. And so maybe, I don't know the history of this this particular death with Miss Maraj, if how long, she was a mother of 5, so I don't know how old was her last child, you know, and that could have been, you know. And what we found too for some of our mothers, especially if they're multi-brava, meaning more than one child, more than, you know, they have several children, they come late to clinic because they think, I know it already, what I'm going there for, I've made 2 already, so what? You know, but each one is different, and you know, you need to go to the early detection. You need to go to the clinic and do your workup, your tests, your blood count, because most of these patients are they have anemia with pregnancy. You know, your HB is supposed to be at 11, and you're going to lose blood. So when you come at less than 11, it's going to be a challenge, you know, to get blood for you and blood transfusion and so forth.
Dr. Cummings, Dr. Anthony is your colleague professionally
Yes.
as a fellow doctor. What advice you see the challenge they're having? Might you say to Frank Anthony, this is what you should be thinking about, perhaps policy-wise, the level of the hospitals?
Well, I think we have a good team. The maternal child health department there, we have been doing pretty well in the past years in terms of vaccination and so forth. So you just have to work with the technical advisor from Pan American Health Organization. The impression I get is that they seem to know it everywhere and they don't want advice from anybody else. So that's one, you have to realize that you don't know it all, and you have to seek help even from the opposition, seek help from your technical partners, PAHO, WHO, and hear from them. You know, secondly, too, I think he needs to have maybe a commission of human resource commission. Of course, we have the NCDs, commission for NCDs and so forth. But where you're going to have particular persons who want to monitor the nurses, monitor their actions, monitor the pregnancies, and those that can oversee in that particular maternal unit, monitor them, know what's going on there. So many, the impression I get, some people are left, some others are left unattended. So you need to have persons who are going to monitor them. The shift system, they should have a supervisor who's going to monitor, so okay, we are short here, and call out
Yeah.
persons and so. But I think in terms of monitoring and evaluation of these pregnancies and so forth, they need to step up, step up.
Yeah. And you
And
did
of course
talk
have the equipment and necessary things to follow up with.
exactly. And Dr. Cummings, you did talk earlier about having, well, paying our health professionals properly.
Yeah.
We were able to do it every year, give an increase to public servants.
Absolutely.
And we didn't have oil and gas money flowing there.
Absolutely, absolutely.
Interestingly enough, you have it now in its bounty.
Going in the wrong direction,
Bountiful.
perhaps.
And exactly as you said, it's going in the wrong direction. We
Yes.
haven't seen any real substantive increase
Yes.
for public servants, especially
Yes,
our
yes.
medical professionals. They've been out there for
Yeah.
COVID, fighting hard, fighting strong, and then nothing.
Yeah, the mission statement must be to have our mothers and our babies, or the healthiest in the South American population, in the Caribbean, and so we have the means, we have the resources to do that. It's just, I guess, the management. We have to manage our resources better, and so rather than be caught up with the other metropolitan countries with procedures, that's where the money is. Let's go back to our basic, our family health care, the primary health care, where that's the crux of the matter. If you get it right there, then the others, it just falls into place.
Fantastic. And Doc, we're talking about some of the challenges where maternal health is concerned. Maternal deaths are clearly on the increase. But generally now, you have a public who is looking at this system. Several challenges. This problem seems to be escalating and not being mitigated. How do you say to people, here is what you should be thinking about in terms of preventing yourself from having to engage this healthcare system? Because clearly it is not geared for this kind of public that we have now who needs good healthcare.
Sherrod, health is a human right. And so we have to hold the people accountable. Our people, we just have to hold them accountable. I mean, we have to agitate a little more and let them step up the game, but we can't hold the people at ransom for the negligence of healthcare professionals or poor management of government's resources. Every year it's getting bigger and bigger. I recall in 2019, the healthcare budget was, I think, 30, how much was it? 30, I'm trying to remember the exact figure I had somewhere, $35.9 billion. And so the WHO, what they were expecting the health budget to be 6% of the GDP. And so we're working towards that. And so we have adequate resources to pay persons, to have the necessary equipment, the working conditions for us to have good, positive health outcomes. And so they have to go back to the drawing board and seek assistance. If they're in doubt, don't be ashamed to say you need help. And get the work done. But you just want this big building, just the optics. It's a big, we just build this.
Yeah, but who's staffing it? And the quality of people who staff
Absolutely,
it.
absolutely. And nowadays we have something called telemedicine, where even you have persons overseas, we can have, x-rays, and we can send up information to the technological age to overseas and so forth. So there's no excuse at this point in time. You have telemedicine, you have PAHO, the WHO, advisors to help us, and then we have training, continuous training for our nurses, and ensure the conditions are right and the money is right too, the price is right, as we would say, and why not? Sure, I am guaranteeing that we're going to have positive health outcomes.
Excellent.
And maternal deaths, because we definitely want to reduce this spate of deaths. There are too many for a small population of Guyana, just 750,000 people.
Definitely. Dr. Karen Cummings, we really want to thank you for spending this time with us today.
Yes.
And bringing clarity to this whole issue of maternal deaths happening currently, and we see us spiking it, and definitely for your thoughts on the other areas of healthcare nationally.
Thank you very much for having me, and I hope that by the time we speak again, we'll have good news in terms of our maternal health and our neonatal, perinatal, and under 5 mortality rate.
Excellent. Thank you.
That was the discussion I had with Dr. Karen Cummings on maternal deaths and some other issues in the health sector, folks. And we got to be so careful. That's why I started by saying you got to be thankful for your health when you have it, because if you submit yourself to the public health sector, my lord, my lord, it's like buying a lotto ticket, hoping everything work out, hoping everything work out. Gotta hope everything work out, folks. Think it's easy out there? You think it's easy in them streets, folks? You think it's easy in them streets? My. We got a lot of work to do, folks. We got a lot of work to do on every front. We got a lot of work to do on every front. I want to thank Dr. Cummings for sitting down with us and trying to make sense of some of what's happening locally. Seeing a spike in maternal deaths, and that got to be a concern to the administration. I don't know what them boys is discussing cabinet meeting, you know. I don't know what they're discussing cabinet meeting, and it's just a lot of hot ear talk. Because the actions clearly they're following. They got a bit of concern to the regime. Oh, we know they're hard-hearted if they got hearts. But we have to be concerned with what is happening in maternal health of our women, and we got to be concerned about infant mortality and all of those things. Well, you all know what happening on the roads speak for itself. What happened on the roads in this country. God forbid anything happens to one of you, you got to access public health. God be with you. God be with you. Good to see Maureen Williams here with us, and Isabella Butters, Maureen and Philomena Fontenelle. Good to see Barry Sanders and all those other guys who are joining us. Good to see each and every one of you. Thanks for that update, Barry and Alex Boom. Good to see you, folks. We trust that you guys are having a fantastic Sunday. And we commend the rest of the day to you, folks. Spend some time with family. Self-care, highly recommended. Eke out some time for you, time for the family, some time for friends even. We want to thank you guys for joining us amid your busy Sunday. Doing what is you folks do every Sunday. So many of you join us from around the world. Claire Capel and Isabella Butchers. It's been a privilege being here with you folks. Again, we want to keep on keeping on, bringing you guys valid and credible information. And we continue to encourage you folks to partner with us. As we say, thoughts and prayers with that family of young man who died yesterday on Enmore Public Road. Anil, our thoughts and prayers go to his family. We have kids. The community loved him. A valuable member of his community there. Our thoughts and prayers go to the community as well of Enmore and his family especially. Folks, partner with us. We can continue to do what we do. We're available by Cash App and Zelle and PayPal. We're available by MMG, MoneyGram, Western Union. You need any help? You need some you got some queries? You need some guidance? 627-6963 is our number. And each donation, as we say here, goes towards expanding, deepening, professionalizing our program, that we can continually bring you credible, valid information. That's going to do it for us at this end, good folks. Rihanna Mingo, Yvonne McPherson, thanks for joining. Leslyn Charles, good to have you folks. Good to have you. Maureen says it's 9:10 a.m., which means we're going to be in London. It's 9:10. Maureen says it's 9:10. Why am I adding a.m.? But good to have you, Maureen. Really good to have you. Isabella Butters, Yvonne Ferguson, Rihanna Mingo, Siobhan McDonald, all the other folks who are joining us. And that's going to do it for us in this end. Stay safe, guys. And do us a big favor. Smash that emoji button before you go. Share the live. And partner with us as well. Happy Sunday, folks. And see you guys back here tomorrow at 8, at 12. And then we're back in the ring at 8 p.m. tomorrow evening. That's going to do it for us. Stay safe, guys. Stay safe. That's our time.